part of the healthcare industry is obviously getting a boost and seeing demand pick up as well, but there's also a part, things like non-essential procedures, medical tourism, that's getting put off a little bit as well. Talk to us about how that's impacting you. On a net-net basis, do you guys think you'll be better off or worse off this year?
Thanks, David, for having me. So this pandemic is affecting all of us in healthcare. For us, there is some short-term impact in terms of deferring non-urgent care or elective cases, and I think that's prudent. But our business is in acute hospitals, so we continue to get plenty of medical conditions which are urgent. We continue to see critical and carry out critical procedures which cannot be delayed. And in addition, we're helping to treat COVID cases in the different countries we operate. Overall, we remain resilient. We have a highly diversified business base across 10 countries. We have a strong track record. And therefore, we will continue to remain resilient during these times.
Right, and one of the markets you're in 10 countries, is India. I want to ask you about that. You have 33 hospitals there. People are trying to figure out what the real situation is on the ground. I mean, yes, we're approaching, I think it's 30,000 infections there. Give us a sense of what you are seeing on the ground from your perspective over in India, very briefly, please.
So India, like many other countries, are clearly affected by this pandemic. As you know, India is in a lockdown situation, which is important because the purpose of a lockdown is to help to flatten the epidemic curve, and that's so that the country can buy time, in turn so the healthcare systems will not be overwhelmed and so that they can respond better. It's really important, even as the country does that private healthcare providers like us step up and help out our public sector institutions, help out the governments win this war. So our hospitals there are doing so. We're helping out with testing. We're helping out with treating patients during this time.
Dr. Loh, in terms of telemedicine, there's been a lot of conversation about the opportunities there. I know you've invested in a company called Doctor Anywhere. How significant do you think that opportunity is, and are you planning further investments in that space?
Yes, very much so. We see the future of healthcare evolving in the sense that healthcare consumers will demand for healthcare information delivered to them in a much more transparent way, and we see them asking for healthcare services delivered in a much more convenient way. So while we are largely in the bricks and mortar business, that is our mainstay of business will be still doing procedures in hospitals, but it's imperative that we invest in digital technologies which will enable to connect with patients better. It is important that we participate in that digital healthcare ecosystem so that we can deliver our services beyond our hospital walls even more conveniently to our patients.
Has medical tourism essentially dried up in this region? And if it has, when do you expect that to rebound?
So medical tourism clearly is impacted, as with all travel across the world. For us, medical travel is part of our business, but as with most of healthcare is really delivered locally. Many of our patients are of local origin, and in that space, treatments and procedures which are urgent continue to need our care. So we are making sure that we're keeping our hospitals safe during this time so we can continue our clinical operations. We are hopeful that this too will pass and medical travel will return, given the strength of our brands in the countries that we operate in.
Dr. Loh, I'm curious what you think and what you've noticed, because you're a physician yourself, and you've been part of the public health sector, hospital planning, what have you. Clearly, what this has shown is a severe lack of capacity. There's a gap in the industry right now. I'm wondering, do you think it's wise moving forward for governments and the private sector to up capacity to the point that things will be enough to cover, frankly, an outbreak that maybe happens once in a generation? How do you invest wisely, given what we've learned so far?
I think the most important thing is to collaborate. And what I mean by that is that there's no way that one sector of the industry, be it public or private, can invest to the point that you cater for every possible emergency or otherwise cater to the maximum possible situation at any one time. So therefore, one can, to be prudent and at the same time be flexible, there should be better collaboration between the private healthcare providers and public healthcare providers. I'm so happy and so proud to see the private healthcare space stepping up during these times, helping out governments to fight this pandemic war. And I hope that such collaboration will continue more even in the future.
Do you think that the private sector and the public sector, I guess that's a final question to you, is underinvesting? We need to invest more? And I guess on the part of your company, are you planning to actually raise money or up investment in this space?
So while we are focused on the short-term priorities now, protecting our staff, keeping clinical operations going, and fighting this pandemic war, we indeed are laying the foundations for the future because demand in healthcare will continue to grow. So we intend to do that by leveraging our international scale so that we can derive economies of scale, help our healthcare consumers bend the healthcare cost inflation curve. At the same time, start investing for growth. We continue to invest in metro clusters we are strong in so that we improve our returns on capital. At the same time, make sure that we can deliver healthcare in a more efficient way.